These are the Namastava canine flap scissor. They have split handles to provide better, more ergonomic grip with your hands, as well as blunt tips to prevent perforation, and flat, thin dissecting blades with a sharper curve to get into tighter spaces. With this instrument, I can maneuver into tighter spaces, bluntly separating mucosa from periosteum, and then sharply incising the periosteum. They also have a serrated edge to them to add to its trimming ability so that it can cut gingiva without needing to waste tissue by grabbing on with our pickups. We apply traction with our thumb forceps. We take the tips of the Namastava scissor and we put them here between the mucosa and the periosteum, and even here there is also some muscular attachment. We push in as we bluntly separate those two layers apart. On one side is the mucosa. On the other side is the periosteum and some muscular attachment. Once we've created this space between the two layers, we can then come in with one blade and safely cut just the periosteum, leaving the mucosa intact. We carry this along the base of the flap, bluntly separating the mucosa from the periosteum, then coming back with one blade and sharply and safely incising just the periosteum. By doing that, we have the cut edge of periosteum is still bonded to the tip of our flap, providing good suture holding ability. The other cut edge of the periosteum is here, down along the bone. If we've done the tension release enough, the flap should lay over the defect with an overlap, proving that we've removed the tension that we want to remove from our flap. Using the Namastava scissor, I'm going to trim the margin of our flap on the palatal surface. I'm debriding the margins of our palatal tissue in a concave contour with bleeding epithelium in the live patient. I also want to take the margin of my buccal flap and I want to debride it in such a way that we make a nice convex contour. And so I'm using the Namastava scissor to make little slivers of tissue using the serrated edge, fine-tuning the contour of my buccal flap margin. When we've debrided the flap margin well enough, we should have a flap contour that will fit very nicely into the defect of the tissue left on the palatal surface. Now we can begin suturing the flap into place.